Hi, I'm Shannon. I'm a level 1 nursing student. I think I have your patient today.
Hi. Do you have Ronald Jarvis?
Yes, I do. Can I hear a report on him?
Yeah, of course. So Ronald Jarvis is a 67-year-old male in room 622. He has no known allergies. He is a full code.
Okay.
His doctor is Kay Phillips. He has been a diabetic type 1 for 20 years now. So he came in, drove himself here from his physician's office, and he was diagnosed with hyperglycemia and a non-healing stage 2 diabetic wound on his right heel. He came in with a pain level of 6 out of 10, and we administered some morphine, so it is now a level 1. His level of consciousness is alert and oriented times 3 to person, place, and situation. He wears glasses. He has 20/20 vision with glasses.
Okay.
His cranial nerves are intact. He has no problems with his cranial nerves. So his mobility, he has full range of motion, and he moves independently. He has sufficient muscle strength to lift himself up in the bed, and he occasionally walks with some help. So if you want to help with ambulating, or if he needs help transferring, you can assist him. He is a fall risk, so he does need to call for assistance if he needs to get out of bed. His breath sounds are clear to auscultate. His pattern is even and effortless. His pulse ox is at 95%. His heart sounds are regular. Apical pulse is regular. Pulse is a +2 as expected, with a heart rate of 80. And his blood pressure is 145/72. His cap refill is less than 3 seconds. His bowel sounds are active in all 4 quadrants. His abdomen is flat to palpate. He is on a diabetic diet of 1,800 calories and a 2-gram sodium restriction. He is continent voids by himself. His last void was 320 mLs, yellow straw colored, and his last blood sugar was taken at 20/30, and it was 242. If it gets above a 301, then we need to notify the doctor.
5 days ago,
He is,
blood glucose levels
because of his stage 2 ulcer, we do need to do some interventions there throughout the night. We do need to turn him Q2 hours, so if you can help with that. So repositioning him, protecting his heels, managing his moisture and nutrition fluids, diet, doing AccuChecks before meals, range of motion activities, and we do need to dress his wound twice a day, so once in the morning and once at night with a dry sterile dressing.
So why specifically is this client receiving this medication?
This client is going to be receiving Glargine Lantus because he is a type 1 diabetic and his pancreas does not produce any insulin on its own, so we're going to provide that for him.
So what action does this medication have on the body?
So this insulin is going to facilitate the uptake of glucose from the muscle and fat by inhibiting the production of glucose in the liver.
And when should you question administering this medication?
So you should question administering this medication if the client is experiencing a hypoglycemic event. So if you take his blood sugar and it's less than 70, we should question administering this medication.
And so does this medication have a therapeutic serum level?
No, it does not.
And which vital signs should we monitor?
So you're going to want to monitor the hemoglobin A1C, and you're going to want to keep an eye on his AccuChecks.
Which physiological parameters should be monitored when the medication is being administered?
So you should assess the site that you're administering for lipodystrophy, any redness, heat swelling, irritation in that area. You should also look out for any signs of hyperglycemia or anaphylactic reactions.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
So you're going to want to teach the
Okay, Mr.
patient
Woods is a type 1 diabetic.
any signs or symptoms of
And
hyper or
diabetes is an
hypoglycemia
autoimmune disease
in
which a
case
person
they are
comes with
experiencing that
self-produced
after
insulin,
the medication
which is a
administration.
that
So
enables
you're going to
people
want to teach
get
them
energy from
to
food.
use their call light in that
And because
situation
Mr.
so
Woods'
we can
pancreas does not
provide
produce
care and help
insulin,
them.
And what
So,
interventions
we
must
have
be
to do
taught
insulin
for taking the
injections.
medication safely at home?
So Glargine Lantus is a long-acting insulin and should not be mixed with
Okay,
any
you
other
should question
insulin. So
for the
you're going to want to
medication
definitely
if,
teach that. You're also going to
his
want to teach
blood
how
level,
to
glucose level is
administer
too low,
the
or if he
medication
has an allergic
safely,
reaction to the
how to
insulin.
dispose of their needles, how to store it properly.
No, it
And
does
what
not.
are the side effects and potential adverse
Okay,
reactions
all
to this
vital signs are
medication?
important, but you would
So
wanna,
any side
monitor
effects
his
or
blood
adverse
glucose
reactions would be
for any signs of
anaphylaxis if they're
hypoglycemia
short of
and,
breath,
any
if
signs
they
of
are
any kind of
having
allergic
itching, things like that, if they are hyper or hypoglycemic, so if they're hot, sweaty,
Okay, you
cold,
wanna,
clammy,
administering this medication,
or
you wanna
if they
rotate
have
the injection sites,
fruity smelling breath,
and, you
they're
don't wanna give it to him if
tachycardy,
he hasn't had anything to eat.
if they're having palpitations, things like that, you're going to want to look for those signs.
And how will you know this medication is effective?
Okay,
You're going to want
want
to check
teach the
their
client
blood
about
glucose
rotating
level and if it
injection
is
sites to
lowering their
prevent
blood glucose and
lipohypertrophy,
keeping it within a normal
which is a
range,
buildup
then
of
you know
extra
it's
fat under the
effective.
skin at
All right,
injection
that's all the
sites.
questions I have for right
And
now.
also
Thank you.
wanna
Okay, do
teach
you
him
want to
about the
watch me
signs and
administer the
symptoms of
medication?
Yes,
Draw-
please.
hypoglycemia.
Okay. So first you're going to want to go into the
At home,
patient's
it's
chart.
basically the same interventions
their
to
MAR.
know the signs and symptoms of hypoglycemia and to rotate the injection sites.
What are the side effects and potential adverse reactions?
The side effects would be hypoglycemia, of course, and any allergic reaction.
Okay, how will we know
Okay,
that the
so you're going to
medication
want to
is
go into their MAR.
You would know that it's effective if his blood glucose level becomes within
And you're
normal
going
range.
to want to pull the medication. So we have Ronald Jarvis,
Would you like
and
to
we're
come?
going to pull the
Okay.
Glargine Lantus that is supposed to be administered for bedtime. So we have Glargine
Hi,
Lantus.
my name is
Expiration
Lynn.
date is 9/2017.
And I am your nurse
It is
tonight.
clear, not cloudy, and there's no particles in
Dante.
it, so
He
it
is a
looks
student
good
nurse
to
at
administer.
St. Jude College, and he is going to be following me. Is it right if
so
he comes in?
That matches our chart in here, our
Can I have
MAR.
your name and birthday?
We're supposed to administer 18 units subcutaneously at bedtime,
Okay, do you have any
and
allergies?
to Ronald Jarvis,
Okay.
and
Your blood glucose was high today, so
So
I'm
we're
going to
gonna
give you some
just
insulin, some
get a
NPH
swab.
insulin. You take NPH at home?
yes,
Okay, and where do you
I'm gonna
usually
put it
take
here on top
Okay.
of the hub, so that we can get rid of all the bacteria. I'm just gonna take this off, and then scrub this a little bit. And then we're gonna draw up 18 units of air. We're gonna inject it in here, the air. And you're gonna draw up 18 units of insulin.
Okay. And then scan the name band. Okay.
And there's no air bubbles in there.
And then you're
And
going
then
to
you're
get
gonna wanna
NPH.
recap your needle one-handed.
And it is a cloudy insulin. And you're going to want to make sure you mix it real good when you give it.
Okay, when it's on there, you can just push it down,
We're gonna
make
be
sure it's
getting
secure,
20
and then
minutes.
you can have another nurse check it. Can you please check this?
Looks like 18 units.
Okay, so you're gonna wanna do that for
And
safety
you're going to want to
measures.
make sure that you clean the top
So
of
we have our
You
18
don't have any
units of
germs.
insulin, Glargine, for bedtime, and we're gonna administer it subcutaneously to Ronald Jarvis. So we're gonna knock.
it. You want to make sure that you draw up 20 units of air.
Hi,
Or the
Ronald.
amount of the
Hi.
insulin that you're going to be
How are you
giving.
doing? Oh, sorry. Good. So I'm Brenda. I'm gonna be your nurse tonight, and this is Shannon. She's a student nurse. Is it okay if she watches you get some insulin glargine lantus for your bedtime?
Yes.
Okay. So can you please tell me what your name and date of
You
birth
make sure that
is?
you have someone checked and make sure
Ronald
it's the correct amount.
Jarvis, 1848.
Okay.
Okay. And do you have any allergies, Ronald?
I do not.
Now, you say you get the injection in your
So
abdomen?
now that
Would
we
you
know
like
we
it
have the
tonight?
right patient, we'll go
Okay.
in and scan his bracelet. And then we're going to scan our medication.
Okay, and I see by your
Arnold,
chart that
do you know what
you
type of
haven't been
insulin
super
this
compliant
is?
with your diet at home.
No.
No?
Maybe you've got a
This
reason why
insulin
blood
is
sugar
your
so
bedtime
out of
dose.
control
It
right
is
now.
a long-acting insulin, so
We
it's going to
have
be
a
working
fabulous
24 hours. It's going to be working all
in the
night,
hospital.
lowering your blood
And
glucose
would you like me to
levels
get some
and
information from her
helping
about
with that,
diets?
okay? So you don't experience
Okay, and I can also ask your
hyperglycemia.
doctor
Oh, okay.
if I can put
Okay,
up
do
in
you
a
understand what
consultation
hypo
for
and
her to just come and talk to
hyperglycemia
you
is?
and give
Yes.
you some more information.
Okay. You have your
Okay.
call light next to you, so if that does
And
happen
I'm
to you,
going
I'd like you
check
to
your
know to
pills.
call. And
So
I
with that
have
ulcer,
brought you some
It's probably
sheets
painful, and I don't want it
to
rubbing
teach you
against the
about
bed linen,
anything
and it could make it worse.
that has to do with your medication. So if you just read over that, and if you have any questions, just let me know
Thank you.
when I come back, okay? So now that we have drawn up the insulin
Okay, I see
already,
that the dressing is still intact.
we're
There's no
going
drainage,
to
and it's
administer
okay.
it. Where was the last place
doctor
that you
has
had your
put in an
medication
order for the
administered?
In my
Wound care
abdomen.
departments to come
Your
and check on
abdomen?
your ulcer and
Okay,
put
where in your
dressings on it, so
abdomen?
you can get it healed more.
I think on the right
Um,
side.
On the right side?
I
Okay,
also
we're going to
give you some
administer it on the
information. I
left
see you don't
side.
wear a medic alert
Do you know why we would
Do you
change
know
the
what that-
sites?
What that is?
So I don't get fatty
Okay,
lumps.
A medic alert
Yeah,
bracelet
exactly.
is, if you have a medical condition like diabetes,
So I'm just
it
going
will let
to
someone
pinch
know
the area.
if something should happen to you, like if you get hypoglycemic and you're driving.
Insert the
It has
insulin, hold it there for a
diabetes on it.
second so it doesn't
On the
leak out.
back, it has an
Take it
emergency
out,
800 number
Put
that
that
whoever's there
in the
can
shorts
call.
container
And it would give them
We're
all
gonna
your
take off our
information, the
gloves.
medication you're on,
and wash our hands,
the
okay?
emergency contact.
Do you have any questions,
like that.
student nurse?
Would you be interested in getting that
I
on that?
do have a
Okay.
couple. Was there any pertinent pieces of information you reviewed before administering the
And
client
just call them and
the medication?
you know,
Okay,
some information about
I'll
that.
talk to you about that in
Very
1
helpful.
second.
Oh.
I'm just going to document
Illness,
before we do that. Do you have any
know that
questions about the
there's something
documentation?
happens.
What do you document?
So you're gonna
And that is all I
document
see with that.
the medication that you
Okay,
administered,
do
which
you have
was
any questions
Glargine
for me?
Lantus. We administered to Ronald Jarvis,
Okay.
and it was 18
is your
units
call light?
subcutaneously at bedtime
Yes,
at
you're gonna fill out the diet.
2100,
You're gonna call that
and
number.
his blood glucose was
And
242,
The diet,
and we're gonna write where we administered
nurses
it
gonna
as
come and
well.
talk to you
So
about diets.
all of that we're gonna
And also,
document plus the
you should be
teaching that we
expecting
did.
wound care nurse to
Okay.
come by
Okay.
soon and
Is
look
there
at your
anything else that we can do for
Okay.
you, Mr.
And your call light
Jarvis?
is here.
No,
If you
you've
need
been
anything,
awesome.
just let me know, okay?
Okay.
You're
So
welcome.
have you. Is there, do you have any snacks by you?
Oh yeah, I do have some crackers.
Okay.
With peanut butter.
Okay, I'll check up on you in a little bit and see how that medication is doing.
Thank
and if
you.
you have any other questions, you can ask me then, okay?
Okay.
Your call light's right next to you.
Were there any
And just call me if
pertinent
you think
pieces
of anything
information
else, okay?
before
Okay,
you
thank
change
you.
the medication?
Okay,
Yes,
sorry
I
about
just
that.
made sure that
Do you
the
want to
client's
ask
blood
your
sugar
questions
was,
now about the
elevated
medications
with
that we
the,
administered?
Yes, I have a
Okay.
couple
Not
more
too low.
questions. Was there any pertinent pieces of information you reviewed before administering the client's medication?
Yes,
Yes, we
her
actually
blood
looked
sugar
at
was
the
elevated
blood
at
sugar level, which
242.
was
So she was,
242.
needed 20
And
minutes
did
of
this
medication.
information affect your decision to administer the medication?
Yes, because
not.
if the blood glucose
Thank
was
you.
too low, we would not have administered it. We would have held it, and if it was too high, we would have called the doctor and notified
Okay,
him
you
about
only got
that.
half of that 'cause there's all
And
that.
did this information affect how you administer the medication?
You know,
No.
I'm teaching you didn't
All right,
record.
I think that's all I have.
No.
All the questions I have today. Thank you.
Thank you.
I had like this attitude.